Hi, my name's Ed Shanshala. I'm the CEO of Ammonoosuc Community Health Services. At ACHS, we provide primary preventive health care. We do so that each of us can stay healthy. Why each of us stay healthy is a very personal and unique story. The following is a personal and unique story of one of our friends, families, or neighbors and why they stay healthy.
When I was probably about 23, 24, I started using very irregularly crystal meth, which over 20 years developed into a really terrible addiction. And I, for a long time, thought I had things under control. I kept my job, I kept my friends and my teeth, everything. Like I was, flying very much under the radar. And then when COVID hit, things kind of came to a head, and I realized that my life had gotten unmanageable. NA was hugely helpful, and the support that I found in that organization, White Mountain Recovery Home in Littleton, was a great place for me to sort of continue my reforming of habits in a safe and sober environment. So that was also very helpful to have that place. And then paired with, of course, the theater company, it really brought me back into just the awareness of what I want to be doing in life. So for me personally, once I made the decision to walk away, there was no going back. The arts were the one thing that really always mattered more than the drugs. So theater has always been a safe haven for me, even in the darkest of times. It was always the one place that I really felt like I belonged and that I thrived. And so even in other areas of my life when I was not thriving, the theater always provided that place where I could still be a bright light and still do the things that I needed to do. So the wonderful thing about discovering theater up here in Littleton, which was a total surprise, is that I was able to jump back into the life that I loved. The reason that I chose to go to rehab and get my life back in order was because ultimately what was happening is I was being taken away from the arts, which I loved. And that is one of the big reasons that I decided to go and get treatment. And so for me, having theater up here, I was able to dive back into the world that I went to get clean for. One of the things that I found during really my active addiction was that I was disappearing. I was, because nobody necessarily pinned me as a drug addict. And being an actor, I really kind of played into that and used that to my advantage to continue to be a very active drug addict for a long time. And now I realize that it's not anything I want to hide. It's not anything that I want to keep a secret, because when you turn to secrecy and when you have double lives, I think that's where I personally got into a lot of trouble. So very much keeping my life out in the open, really owning my story and not being ashamed of talking about it, has also just brought a different light to the whole thing. My role in the healthcare world, where I see that as an opportunity, is to really provide caring and empathy for people. They're not coming, when I see them, they're not coming in because they're in a great place in their life. And so having a friendly face, a kind ear, somebody who can meet them, and be the face for my clinic, I feel like I actually have the opportunity to provide a lot of healing energy. When people have access to the entire network of providing, where they have the more personal sort of community care that things like Ammonoosuc would provide, but then also have the resources to be able to go and use, whatever kind of testing machinery, whatever needs to be utilized. And I think having that relationship between a larger healthcare organization and community health centers really makes both programs stronger.